If you've had recurrent miscarriages, multiple chemical pregnancies, or failed IVF cycles, there's one condition that's often missed, and until you test for it, you won't know it's there. It's called chronic endometritis, and most people don't even know to look for it. In this video, I'm going to show you when to suspect it, why it often goes undetected, and exactly how to test for it. I'm Dr. Cindy. My husband, Dr. Cody, and I are the doctors behind Fertility for Two. We help couples get pregnant naturally. So, what is chronic endometritis? It's low-grade chronic inflammation of the uterine lining. It's not the kind of inflammation that you feel. There's no pain and no obvious symptoms. It's low-grade inflammation like a smoldering heat rather than a blazing fire. And it changes the uterine environment where implantation is supposed to happen. Chronic endometritis can prevent implantation, reduce pregnancy rates, and increase the risk of early miscarriage. In order for implantation to occur, the uterine lining needs to be receptive, stable, and properly regulated from an immune standpoint. Chronic inflammation interferes with that balance by disrupting signaling between the embryo and the uterine lining, which reduces the likelihood that the embryo successfully implants. Because chronic inflammation interferes with immune tolerance, this makes it harder for a pregnancy to continue, even after implantation. Chronic endometritis is usually driven by a few things. First is low-grade bacterial infection from organisms like E. coli, streptococcus, enterococcus, mycoplasma, or ureaplasma. These organisms can persist at low levels and trigger ongoing inflammation in the uterine lining. Second is uterine or vaginal dysbiosis. This is when a number of protective bacteria like lactobacillus are reduced, allowing pro-inflammatory bacteria to take over. The third cause is past procedures or infections that never fully resolve. Things like a previous D&C, postpartum changes, IUD insertions, or prior infections can leave behind lingering inflammatory response. And fourth is immune-driven inflammation, where the immune system stays activated in the uterine lining after the infection has cleared. As you can see, it's not always one clear event. More often than not, it's a gradual shift of the uterine environment over time. So, you should consider chronic endometritis if you've been trying to conceive without success for over 6 months, if you've been diagnosed with unexplained infertility, if you've had multiple failed IVF transfers, especially when the embryos are strong, or if you've had recurrent early losses without a clear cause. Because chronic endometritis doesn't just show up on ultrasound, basic labs, or standard fertility testing. It's not the same as an acute infection. Most women with chronic endometritis don't have pelvic pain. They don't have abnormal bleeding or feel anything unusual. This is exactly why it's so often missed. It's a subclinical, persistent inflammatory state, like that smoldering heat I mentioned earlier. So, if you suspect this could be the cause of your fertility struggles, the first step is to confirm whether it's actually present by requesting a CD138 test. This is done through a uterine biopsy, and it looks for plasma cells in the uterine lining, which indicates chronic inflammation. This is not part of standard fertility workup. If it's positive, that's when you move into targeted testing to identify what's driving that inflammation so you can treat it correctly. Chronic endometritis is not obvious. It doesn't always cause symptoms, but it can interfere with implantation. And if you don't test for it, you'll never find it. This is exactly why a deeper investigation matters, because when everything looks normal, but you're still not getting or staying pregnant, we need to identify and treat the root cause of your fertility struggles. So if you want a clear breakdown of what to test, when to test it, and how to interpret beyond standard ranges, we've put that together for you. You can access it below. Now, if you're ready for one-on-one support and comprehensive investigation of your fertility, you can apply to work with us through the link in the description. From our family to yours, have a fertile day.